So today there are 19 new cases in the community to report. 18 of those are in Auckland and one is in northern Hauraki, a student at Mangatangi School who is already in isolation. Today's cases take our total number of cases in the outbreak to 1,249. There are also 6 cases in managed isolation to report today. Now, of today's cases, 16 are known household or other contacts. 1 is a household contact who had not previously been identified, and 1 is a possible contact. And looking back to yesterday's large number of cases, just 4 remain unlinked at this point, with investigations ongoing. So Delta's high infectiousness is played out within household, and that underpins some of the numbers we've been reporting over recent days. We know from a number of the already notified contacts in our system, we're expecting another 30 or so cases over coming days from day 5 and day 12 testing. And just regarding where our current cases are coming from, 19 of our recent cases have been linked to transitional or emergency housing. This is some, but by no means all of our new cases. Now, just going back to Mangatangi School, as I mentioned earlier, one of those is a student from the school in Upper Hauraki who has been isolating at home for the last 10 days. The positive result was returned because the student became symptomatic and was tested around day 11. A small number of household contacts of the student are being followed up by the public health staff today. The student is one of 98 who have now received day 12 tests, both students and staff. 96 negative results have been returned, this 1 positive result, and the final outstanding test is expected to be done today. The student was initially tested negative, but was retested, as I say, when they did develop symptoms in the last few days. As this case has been in isolation at home, the risk of spread is currently regarded as low. The student is transferring to a quarantine facility in Auckland with a family member. Now, while not included in the case numbers today, there is a positive result in a managed isolation work at Nomi Hotel in Auckland. This case is still being investigated to determine if it's border-related or part of the existing community outbreak, and urgent whole genome sequencing is being done to help shed light on this. The worker is, of course, fully vaccinated and was last tested on the 14th of September, and this positive result was picked up again through regular fortnightly testing. Public health staff are just making inquiries today to check if any other staff or returnees require additional testing or other action. And on the subject of testing, you'll be aware there is both targeted and surveillance, wider surveillance testing underway in Auckland. There were over 11,000 tests taken across Auckland yesterday, and thank you to everybody who was tested. Our suburbs of interest have been updated. Otara is no longer one of those suburbs of interest, and Henderson and Papakura now are. So we want people in the suburbs of interest. The other ones that are still there are Clover Park, Mangere, Favona, Manurewa, and Mount Wellington/Sylvia Park. If you're in those suburbs, please come forward and get tested, whether or not you have symptoms. This is to ensure that we both find symptomatic cases but also undertake surveillance testing to check if there are any unidentified chains of transmission. The testing teams in Auckland are also going out to around 40 transitional and emergency housing sites over coming days to offer testing to all those residents there. Most important, though, for people anywhere they are across the motu is if you have any flu or cold symptoms, no matter how mild, go and get a test. And back to the subject of long COVID, we're learning more and more about the long-term effects of COVID-19 infection, what is now referred to as long COVID. To be clear, long COVID is real. A new study by the University of Oxford and the UK National Institute for Health Research found more than 1 in 3 people with COVID-19 will experience at least one symptom of long COVID. This study included more than 270,000 people recovering there. They found 37% of patients had at least one long COVID symptom, diagnosed 3 to 6 months after infection. The most common symptoms were breathing problems, abdominal symptoms, fatigue, pain, and anxiety or depression. Now, although people who get flu or other viral illnesses can also have prolonged post-viral symptoms, the study found the symptoms linked to COVID were 50% more common than those in those who had COVID compared to people who had had flu. And finally, I would like to acknowledge a free new taxi service which begins in Auckland today to help get more people vaccinated there. Auckland's co-op Blue Bubble taxis will transfer people who have previously been unable to get to vaccination centres for free. This service is those having their first doses only who are either unable to drive or can't access other forms of transport. It's open to whānau bubbles of all sizes, as shuttles as well as taxis are also available. A great initiative. Back to you, Prime Minister.
Thank you, Dr Bloomfield. As you can see, there has been some volatility in cases in recent days. At this stage, though, we continue to have broad control of the COVID outbreak in Auckland, and control is key. We simply do not have enough people vaccinated in Auckland or in New Zealand to tolerate a widespread outbreak. But maintaining that control is not a given, and the public health team in Auckland need our help. Firstly, while we put on the individual armour of the vaccine, we still need the restrictions that we're using. I know they're hard. I know they're incredibly hard, and they will ease. But for now, they're doing a job for us. That's why we need people to keep following them. And this is also an important time to remind people that this is not an outbreak that is in one part of Tamaki Makaurau. In fact, we have a cluster at present in West Auckland. That's why we need everyone on high alert, but with a particular focus on some of the new additional suburbs we've talked about today, Henderson and Papakura. We're asking people with even mild symptoms to be tested in those areas, but again across all of New Zealand. If you have symptoms, please be tested, but particularly Henderson and Papakura we're adding to our list. The second ask again, as always, is vaccines. Since the outbreak began, Aucklanders have turned out in force to get vaccinated. And they've done a brilliant job, but there is still some way to go. We need everyone to be double vaccinated. We know it can and will make a difference, even for this outbreak. Only 3% of our cases in this outbreak were fully vaccinated. Obviously, the vast majority were not. Vaccines matter. They keep us safe. They're helping us to control this outbreak, and they will literally give you choices in the future. 83% of eligible Aucklanders have turned out to get their first dose, and across the rest of the country, 80% of those who are over the age of 12 have either had their first dose or are booked for their first dose, which is fantastic. But we have seen that achieving 90% is possible. Groups within New Zealand are already showing us this. Nationally, 92% of our over 65s have had their first COVID vaccine, and nearly 90% have either had or are booked in to have their second. It is possible to hit 90, and we need everyone to put that effort in. That's why it's great to see regions across New Zealand are entering into a bit of competitive spirit, with Canterbury businesses launching a 90% We're Worth It campaign, and the top of the south attributing their high vaccination rates to freezing work visits and stadium clinics. Local chambers, councils and businesses are showing incredible leadership to drive up our vaccination numbers. They know, as I know, that we can be world leading in getting our population vaccinated. And while vaccinations are being available at more than 1,400 different places to date, sometimes it is a matter of getting there that gets in the way. That's why I do want to, again, reiterate the new service that Dr Bloomfield has just mentioned, a free taxi and shuttle service to get people to community vaccination centres. As Dr Bloomfield said, it's available from tomorrow for families of all sizes who can't drive or don't have transport to be vaccinated. If you are someone who needs this service, you can contact 0800 28 29 26. That's 0800 28 29 26. That's the vaccine helpline. Also today is the second day of a drive-through vaccination centre for Te Walu, Kiribati and Tokelau communities in Te Atatu at 40 Kiri Avenue, and it's running until 4:30 p.m. today. On Friday and Saturday, there is a pop-up drive-through at Henderson High School and another for the Samoan community at the Vodafone Event Centre. There is also a testing and vaccination 2-day session beginning at Bunnings and Mangatangi in Manukau today. So if you're popping down for some click and collect, you can also be both tested and vaccinated at the same place. If it's time that is stopping you from getting a vaccine, please can I ask again employers to give your employees the gift of time and encourage them to get their jab. You know as I do that people are always our greatest asset, and is there any greater way to show your employees that you care than by keeping them well? Please do it today. It is of course our ticket to greater freedom and greater control. Before I hand over to questions, I want to acknowledge the significant policy announcement that was made today on the pathway to residency. We've talked a lot about the team of 5 million. Some of that team had been here for the entire time of COVID, but on visas that haven't given them certainty for the long term. Some may have been here more recently, but have skills that are scarce and that we need to hold on to. So for those who are settled, skilled and scarce, we are offering a pathway to residency that acknowledges the one-off situation we are in with this pandemic. This represents the most significant announcement in immigration policy in recent memory. It is one that we've been working hard on behind the scenes for many months, but one we are also very proud of. I know this will be a welcome move for communities, for employers, and for the team of 5 million as a whole.